Hey everyone, thank you so much for joining us tonight on our second rendition of the cancer advocacy conversation. I'm really excited to have Felicia and Brandy Lee back to talk about cancer advocacy and why it's so important, and how talking to your members of Congress and their staff really does make a difference to get a lot of these bills passed and get them your members of Congress to really co-sponsor these bills and to understand why they're so important. So we really appreciate everyone joining. This is really meant to be a conversation, so use the chat if you have any questions, or just raise your hand or unmute and call them out. We really, we've meant this to be really informal. So if you do have any questions, just let us know as we're going. But with that, I'm going to throw it over to Brandy Lee to introduce herself, and then throw it over to Felicia for her introduction. So Brandy Lee, take it away.
Brandy, you're muted.
I swear I pressed the button. Again, very informal. Welcome to the world of Zoom, right? So my name is Brandy Lee, and I work at the Shepard Foundation as Director of Patient Advocacy. And I came into this role in probably the worst possible way. A lot of you know my story, but for those of you that don't, my youngest son, Finn, he actually battled a very aggressive cancer called rhabdomyosarcoma for 2.5 years, from 2016 to 2018. He was 1.5 at diagnosis, and he ended up tragically dying from rhabdo in December of 2018, just shy of his 4th birthday. I have shared his story many times on Capitol Hill and with strangers and friends and family, and it never gets easier. It is one of the worst things that could possibly happen to you, I think, on this earth. And I know that I have some other bereaved parents on the call, and some loved ones that are on the call that have lost loved ones. And I am here to tell you that I am in the fight because of what we've gone through and what people are continuing to go through every single day with rare cancer, and with any cancer, really. I don't know if you guys can mute. I think it's fixed now, but I just heard some feedback. So yeah, I learned a lot through Finn's journey. And tragically, Finn died from things that I think are oversights in our cancer system, and things that we can change and that are very possible to change. So that's one of the reasons why I do what I do and talk to everybody and anybody I can. And I know that we're all probably on here for very similar reasons, and that's to make cancer universally survivable for everybody. So thank you all for joining, and I can turn it over to Felicia if that's okay, John.
Sure. Good evening, everyone. I'm Felicia Woods. I am the Executive Director of the Cancer Policy Institute at the Cancer Support Community. And just a little bit about the Cancer Support Community. Our mission is to work to ensure that all people impacted by cancer are empowered by knowledge, strengthened by action, and sustained by community. We primarily focus on providing psychosocial support for people who are impacted by cancer, and that is those who have been in active treatment, cancer survivors, as well as their loved ones. Throughout the country, you can find a cancer support facility. We have about 175 locations nationwide, where pre-pandemic you could walk in through our doors to get any type of support services that you're looking for. Also, we have a helpline that really works with patients to help them navigate this fragmented healthcare system that we have, especially right now during the troublesome times of the global pandemic that we're all a part of. Prior to working in cancer advocacy, I spent some time working on Capitol Hill for 2 members of Congress. I worked for former U.S. Congressman Russ Carnahan from Missouri, and also former U.S. Senator Claire McCaskill. Some of you may see her a lot on MSNBC. That's my former boss. And I'm not from Missouri, but I do have a big Missouri connection. And I enjoyed working for members who advocated on behalf of others, people that are impacted by various diseases, especially cancer, and wanting to make sure that they have access to affordable health care. So happy to be here today.
Thanks so much, both of you. So one of the things why we're here today is just to talk about the importance of advocacy to your members of Congress, whether it be state or local or federal, and to really talk about why you think certain bills or policies should be enacted. I'm John, I'm with G2G, but I also, like Felicia, have a background on Capitol Hill. I worked on healthcare policy for a senator from Pennsylvania. And the reason, one of the things that anytime I asked the senator to co-sponsor a piece of legislation, he would ask me what constituents have asked us to co-sponsor this, and how does this directly help Pennsylvanians? And unless I had that conversation with a constituent or a group of constituents, I wouldn't know why that bill was so important to Pennsylvanians. And he was really focused on our constituents and what the Pennsylvanians really thought about. And Felicia, I know you probably have similar experiences with your bosses. So we're here just today to talk about why it's so important, how you can get in touch with your members of Congress and things like that. So Felicia, maybe I'll throw it over to you to talk a little bit about your experiences and with constituents and patients, and why it really is an important thing to do.
Sure, happy to discuss. So from the Capitol Hill staffer standpoint, working with 2, they were uplifting and being asked for their constituencies. We had to ensure that any type of legislation that was presented to the boss, it was properly vetted, but also had the support of the community within Missouri. And oftentimes, specifically working for Representative Carnahan, he would ask, what are my constituents saying about this legislation? Are they for it? Are they against it? What are ways that I can make sure to talk to them about what is the messaging around this legislation? I know when the Affordable Care Act came down the pike, that was revolutionary for our time. It was a time where everybody wanted to be part of the healthcare discussion. And for almost 40 years, coming up with a comprehensive healthcare package had been the topic on Capitol Hill. And back in 2008, 2009, 2010, and on into 2011, it was the debate before Congress, during those sessions. So different pieces of the legislation, we would go back to the community and say, is this something that you support? What are the patient stories? What are patients seeing? What are they seeing in their day-to-day? And how would this legislation affect them? One thing is about pre-existing conditions. We know at that time, may not be able to get coverage from an insurer if you had a pre-existing condition, and cancer is definitely a pre-existing condition. Or extending healthcare insurance to an individual who was 26 years old, making sure that children were able to stay on their parents' health plan. We heard from people in college who are like 21, 22, just getting out of college, just graduating, and hadn't landed that full-time job that would offer them the benefits that they needed, and they needed to be on their parents' plan because they had, you know, a condition, a pre-existing condition that excluded them from getting offered a healthcare plan. So having those patient stories really was a way for me to advocate and talk to my member of Congress about, this is why you should support the bill. We're hearing from, I don't know, we've gotten 860 letters in support of this provision. I think you should sponsor this legislation. And looking at it from the lens of being a patient advocate and going up to Capitol Hill, that's a different way of approaching your legislators, being empowered by going up to the Hill and saying, you know, in my day-to-day, I need you to pass this legislation because it will help me to get access to better treatments and better care, or help my child get access to better pediatric care for a pediatric cancer. I found it very rewarding when volunteers who are living with a disease or living with an issue can talk to a member and talk from their heart and talk from the emotional standpoint of why something is important. It's not just, I'm a data point, but when you think about the human aspect of legislation, that's where advocacy comes in. And I believe that members of Congress are more appreciative of hearing from people when they're debating these issues, and that helps fuel them when they make the critical decisions to vote yes or no for a policy principle that will be, you know, stood up over time and last into perpetuity.
Thanks so much, Felicia. And one of the things that we're here to talk about today, and I know there are so many pieces of legislation that the cancer community cares about and that is really they really support. One of the things that we wanted to talk about, or one of the things that we've been doing with Shepard, has been really advocating for the Cancer Patient Equity Act. And really what this bill does is it ensures that all patients that are covered under Medicare, Medicaid, or CHIP are able to get molecular diagnostics reimbursed at their first diagnosis, and really adding a provision that would help medical students and physicians, healthcare providers that are going back for continuing medical education understand the importance of these molecular diagnostics. I know Brandy Lee has been up on Capitol Hill, not only talking about this bill, but also about continuing funding for rare cancers and cancers in general for the appropriations process. Brandy Lee, maybe you can, because I know this was something that was really new to you when you first started, and it wasn't something that you ever thought you'd be doing up on Capitol Hill and sitting in the Capitol and Senator Durbin's office, meeting with him to talk about these cancer issues. I think there's probably a lot of people, or there might be some people on this call that have never done this or might be a little bit nervous to do it. Can you just maybe talk about your experiences, maybe in the beginning, and why it's so important and how easy it's been, or any of your thoughts?
Yeah, as John was alluding to, and for some of you, you may know this about me, or I've shared it on a couple different calls, but I really hated politics when I was younger, like in high school. And I mean, really up until 5 years ago or so, I embarrassingly just did not pay much attention. I didn't think that I could understand it or that I could make a difference. And so I was one of the people that fell into the category of, I'm just going to let everybody else do their thing and, you know, vote or do what they're doing, because I don't know, I don't understand it. And I just hunkered down in my own little world and didn't really pay much attention until I lost Finn, and I was like, okay, there are major gaps in the system, things that need to be changed. And so, yes, we can change things at the local level. There can be local foundations or even national organizations that can give cancer families support, or they can provide different things. But from what I understood and where I sat, the molecular diagnostics piece was like this glaring thing to me that was like, we need to be doing this at diagnosis for everybody. Why are parents not educated? Why are patients not educated on what this is and what it tells us and how it can help the researchers? And there's a common phrase, bench to bedside in the science community, or in, I guess, healthcare, is, bench being in the lab doing the lab work and the research. So the bench side all the way to bedside to taking it to patients. So I felt like
this call about cancer.
I felt like understanding that and having walked through these horrendous things that I saw my son go through, it was a no-brainer to me that I had to do something. And so getting over that hurdle of hating politics and trying to understand it. And it honestly, it gave me so much purpose and so much meaning to share Finn's story after he was gone, and to know that what he went through was not in vain, and that I could share his story and it could make a difference. And maybe I didn't believe it would make a difference until I started doing it, but in the beginning, it was so therapeutic for me to be able to do that, and kind of sharing like what I saw from my perspective, what my son went through, and the things that I think could have made a huge difference in his treatment process. It was, I hate to say it because rewarding makes it sound like it was, amazing, to go to Capitol Hill and share the story of what your child went through and then they ultimately died is still tragic and awful, but it was rewarding in the sense that like it was like therapy, and it gave me this internal piece of like, okay, I'm doing this for you, Finn. Like we're gonna help change the system because of what you went through, and your death is not going to be in vain. And so going to Capitol Hill, I was super nervous, but I like talking to people, and I usually don't meet a stranger. So I just kind of took that people loving part of my personality and I just applied it and just started sharing Finn's story. And it was, I have you and Liz, John and Liz, to thank for coaching me through before we would sit down in these meetings. But ultimately, it really is just a conversation and you sharing your story from your heart and being able to let them know that there are stories that are happening, that there are cancer patients' journeys that are happening that are very tragic and they're not victorious. And we need to do something about those patients that are not able to survive their cancers, and that there are things that we can do at the federal level to make a huge difference. So I think even for people that are not people or that are super shy or introverted or whatever whatever may be preventing you from sharing your story, it can, you can still do it via email. You can still do it by phone. You don't have to actually go and sit down in person. And besides, it's the pandemic still, and COVID has very much changed the way that we can go to Capitol Hill, or we can't go at all. So for right now, really the only thing we have, and I'll let you kind of go over that, John, but it's just emailing and calling, and then kind of taking to social media too. And even within our communities, which is part of these conversations too, is just doing outreach and advocacy and having conversations within our own communities and letting people know, hey, I heard about this bill that can really make a difference for cancer patients. And there's a bunch of them. There's not just Cancer Patient Equity Act. There's a bunch of them that are really, really important. And so being able to just even talk to your friends and your family and everyone in your community is really helpful. So you can even start small like that instead of running to the hill.
Thanks, Brandy Lee. Felicia, you have been so successful in your current role, getting bills passed and getting bills with lots of co-sponsors. Can you really talk about how maybe some of the bills that you're currently working on or that you worked on in the cancer space, that you harnessed advocacy to really get either the bills passed or to get a lot of co-sponsors, or it just start moving through the system? Can you maybe give one or two examples of that and why it's so important?
Sure. So while I was working for the American Cancer Society, Cancer Action Network, and also in my capacity at the cancer support community, we have been advocating for a bill related to palliative care. It's the Palliative Care Hospice Education and Training Act. It's called PCHETA affectionately. And this legislation would really enhance and increase the palliative care workforce. As we know, it's really instrumental to have a palliative care team when you're going through cancer, and because you have different people on the team. You have your chaplains, you also have social workers, your nurses, oncology nurses, as well as your provider on the team to give that patient the psychosocial support that they deserve as they're going through their cancer experience. So we've been advocating for passage of this legislation for a number of Congresses now. I think the first bill was introduced in 2015. So that was while I was on Capitol Hill that the first introduction of the bill happened. But in my time in advocacy, what I've noticed is that after each advocacy day, where you have volunteers come up to share their story with members of Congress of why palliative care is necessary and why there needs to be more of a robust national campaign to help people understand what palliative care is, in addition to increasing the palliative care workforce. We saw the numbers of co-sponsors on both the House and Senate side double and triple because of that connection that patients can make and volunteers can make with their members of Congress to get their support. And it goes, that traction, once we see that traction, then people like me, lobbyists, can come in and say, thank you so much for your work in becoming a co-sponsor. We appreciate you talking to, Sarah, who came in and told you her story. Now that you're a co-sponsor, then we can go through like the committee process and also getting that bill to come up to the floor and getting it passed. For PCHETA, we're still trying to get it over the finish line. We have a lot of support for the bill. I think last Congress, PCHETA passed the House and it almost passed the Senate, but because of some slight hiccups in, I think, the technical wording of the legislation, it did not pass. But that does not discount all the great work that the patient advocates did to move the needle and move the legislation forward. Another piece of legislation that took the strength of advocates was a bill called the Henrietta Lacks Enhancing Cancer Research Act. Now, this bill became law at the first of 2021. It was a bill that I worked with some of my colleagues and also members of the House to help draft. And we thought thoughtfully on how to make clinical trials more diverse when it comes to cancer, having more diverse participants in cancer clinical trials. And because of the lobby days behind this legislation, we were able to get Republican members on the bill because at first it was a very Democratic heavy bill. And we know that right now we need bipartisan support to move anything through Congress, as we've all seen, and the things that are playing out right now on our news feeds. And it took the strength of advocates to push that over. I could not do it alone, and neither could the bill sponsors. But as soon as we got the advocates to talk about why more people of color or more people living in rural areas or more people with from lower socioeconomic backgrounds need to have access to clinical trials, the co-sponsors started rolling in. And the next thing you know, we were able to get the legislation passed in the House. And then simultaneously the next week, it passed in the Senate and was sent to President Trump to be signed into law. And that was record timing for a piece of legislation to get signed into law. We introduced that bill in October of 2019, and it became law January 4th, 2021. And I have never seen anything like that. And that was really from the strength of advocates.
Thank you so much, Felicia. I think before I'm gonna talk a little bit and show you a little bit about our toolkit and how easy it is to really reach out to your members of Congress. Shepard is not the only toolkit out there. A lot of folks have these, so it's really easy to do. But before I do that, I wanted to open it up to all of you for questions for either Felicia or Brady Lee or myself. Before we sort of move into the next phase of the discussion. But yeah, does anyone have any questions or want to make any comments about your own experiences or anything like that? Please feel free to unmute and either ask or share. Anyone? Anyone want to share?
Only somebody's dog does.
Oh my God, I'm so sorry. That's me.
It's okay, Christine.
Sorry.
So great.
Okay, well, why don't, if no one has any questions, I'm going to share my screen. Just give me 1 second to be able to do that, and just go through the Shepard toolkit. And like I said, a lot of folks have these toolkits. So can you guys see my screen?
Mm-hmm.
Okay, so here, if it just rarecancertoolkit.com, and then you can go to the Action Center, which is where I am here. And then here, this tab up here, you can learn a little bit more about the bill, the Cancer Patient Equity Act. It goes through the major provisions of the bill, and then you can click here to contact your reps. If you would like, but you can also go back to that Action Center that I was showing you here. And I'm gonna close this really quick, hold on. Hold on, there we go. So you can go to, and I think we have a question. Oh, here we go. Thanks, Brandy Lee. So you can go here to contact your reps. And what you can do is you can take this action and you put in your information here. And I will put my information in right now. I'm actually going to put my parents' address in because I want to make sure that we can. I live in Washington, D.C., so I don't have senators. So I want to make sure that you're able to see both everything here. Okay, and you can hit take action, and here it will bring you to things that you want to be able to do. So you can either call your senators and your representatives. So mine are Senator Pat Toomey, Senator Bob Casey, and Congressman Matt Cartwright. And it gives you their phone numbers right here. And this is a little bit of a script that we have written. It's pretty simple. It just says your name. I'm calling to ask that Senator Casey co-sponsor HR or S, which hopefully we'll get an S very soon. We're very close to getting it introduced in the Senate, but I'm calling to ask Congressman Matt Cartwright to co-sponsor HR 5377, the Cancer Patient Equity Act. And then there's a little space here for you to tell your own story. You don't need to go into 20 minutes. You don't have to talk a lot about your own experiences if you don't want. Some people really want to talk about their own diagnosis and why this is so important to them, or a family member's diagnosis. You might just say, hey, I have family that have had cancer. I really want you to co-sponsor this bill. It would have helped them. And then there's a little bit more here of a script. And then you just ask them to co-sponsor, and then you can be done. And then there's an email. So here is the email that when you hit send, it'll go to all of these members. And here it's the same thing. We have a little bit of an email form, and then we have a space to add your personal story, and you can type in your own personal story. And like I said earlier, it could be couple paragraphs. It can be one or two sentences, whatever you feel comfortable or you have the time to do, and then you hit send, and it goes to your members of Congress. The reason why we really like to, and I'm going to give you a little bit of inside knowledge for those who don't know a lot about the Capitol Hill email systems, is a lot of these email systems that they use will bunch letters together. So if they're word for word the exact same letter, usually they get bunched into one, and they still get them, and they still know that 500 people wrote the exact same letter for this bill. But if you change even one line of that letter, in most systems, it'll come up 1. So they will know that 500 individual people wrote or changed the letter, put their own opinions in there. And for me, when I was working on Capitol Hill, one of my jobs was to respond to all these emails. And if I knew that we got 500 individual people that wrote their own stories about why this is so important, I looked twice about it, and I was like, okay, I'm gonna read some of these, and I'm gonna send some of these to the senator to show exactly why he should co-sponsor this bill. So if you don't have time to do it, you definitely don't have to do it. But we do give you that option here. And then you can just put, would you like a response? Yes or no, your phone number, your title, and then you can go. And then for all those folks that use Twitter with social media, you can tweet right at your member of Congress. So this is the majority of the toolkit that I wanted to show you. You can also, if you want to know more about the bill, you can go to congress.gov and just type in HR 5377, and the bill comes up. You can see right in here, there are 11. So they don't have a summary yet. It's a pretty new bill, so they don't have that summary done yet. But here is the exact text of the piece of legislation. It will tell you what actions were taken. So right now it was really, if you go to all actions, it was introduced in the House, and it was referred to the Energy and Commerce and Ways and Means committees, and referred to the subcommittees on health. And then here you can look at the co-sponsors, and you can notice we're almost tied here with these co-sponsors. So these are the members of Congress that have already co-sponsored, and we've been doing a lot of outreach on our own end to try to get these up. But given that there's 435 members, there's only 11 so far, so we really have a long way to go. This is, I'm going to stop my screen I'm going to stop my screen sharing right now, and sort of turn it back over to you all before I throw it over to Brandy Lee and Felicia. Does anyone have any questions about that toolkit or other ways that you can reach out to your members? Anyone? Okay. Hearing none, we can wrap up here, but maybe I'll throw it over to Felicia. Do you have any ending words that you'd like to share about advocacy, or how it's important, or the importance of the cancer community coming together on bills like this one, or any of the other many cancer pieces of legislation that are out there?
Sure, happy to comment. I actually, when Brandy Lee was saying as she was growing up, politics was not an interest of hers, I can agree. You know, I stayed up to date with like current events, but it wasn't something an area that I thought I would go into. My idea, when I went to college, was that I would be a psychiatrist. And I never imagined that I would work in cancer advocacy, or that I would work on Capitol Hill. But, after being in AmeriCorps, I was in AmeriCorps Vista, and we were charged with going up to our state capitol to advocate for juvenile justice reform. And I was 21, talking to state representatives and saying, this is why, this needs to happen. This is why we need change. and very nervous about it. But, systematic changes can only happen if people really use their voice to talk to members in the legislatures, and also elevate their voice locally, statewide, and federally. And so I say that to say that advocacy is indeed an important area where we need more volunteers. We need more people to come to the Hill or write letters telling your personal story, because what members of Congress don't know, they don't know. And so they're stretched to different limits trying to understand different issues that many of them have never in their lives mastered. But what is going on in your world, what your day-to-day, and I keep saying that, what your day-to-day is, and what your lived experience with cancer, or your child's experience with cancer, or another loved one's experience with cancer has been. So you can tell them why, not having access to Medicaid has really harmed me or my family member in getting the care that they needed during a very difficult time. Or, right now during the pandemic, losing a job while my family member is going through chemotherapy and not having that healthcare insurance was devastating for us. You need to make sure that there are protections in place to help people in those troublesome times. So hearing that voice, if we don't use our own voices and be our own advocates, we can't count on others to advocate for us unless they have experienced it too. So I charge all of you to just, write a letter to Capitol Hill. The emails are easy to do. And I will put in our CSC's action email address where you can sign up to get action alerts from CSC. We're always sending things up to Capitol Hill. I'm sure they get sick of us, but we will never stop until we can end cancer. So that's our mission and that's our goal. But thank you for the opportunity.
Thanks so much, Felicia. And I can just comment a second about something very similar. I mean, members of Congress and their staff, they don't have your experiences all the time. They might have their own experiences. I mean, I came in as a healthcare staffer. I knew my grandma had diabetes. I knew stuff about diabetes, but I didn't know people that had ALS. So when people would come in and say, "Hey, there's this new treatment that isn't covered, you need to get it covered," and I would say, "How aren't we covering this treatment? Let me look into this and let me get a little bit more." And it wasn't because me or the senator didn't care. It's just because there's so much happening out there that we need advocates, we need our constituents to tell us what is important to them and what is going on out there. And it's really the best way to be able to do that. So I just wanted to talk a little bit about that. Laura, we are following the Multicancer Early Detection Act. It is one of the bills that I'm actually personally following. I get alerts every day when new co-sponsors are added. And that is one of the bills that every single morning I wake up and there are more and more co-sponsors to that bill. I believe, and I'm hoping I'm talking about the same one, but I believe Congresswoman Sewell introduced that bill. And like I said, every day I wake up and there's so many new co-sponsors. So whoever is advocating for that is doing a great job, because there are so many every day. Like I said, every day I wake up, I'm like, how many more co-sponsored it today? So yeah, that is definitely a bill that we are tracking at Shepard and at G2G. So yeah, thanks. Yeah, thanks so much. So Brandy Lee, I'll let you close out the show here and give the final words.
Oh, wow, John, you're too kind. I actually was thinking along the same lines that you and Felicia were just talking about, in that a lot of times I think that we have the general public has this misconception that everyone on Capitol Hill knows every issue that they need to be creating legislation for or working on, and it's just not the case. They're human just like we are, and there's a lot of different issues that they are not aware of. And I remember, so was it Durbin's office? I was sitting in Durbin's office and I asked him why pediatric cancer or cancer in general is not a national health crisis. And he said, to be honest with you, we just don't know. We don't know unless our constituents come and tell us or write in and tell us. And I remember feeling shocked, like, what? How could you not know? But then I thought about it, and he gave the example, I think it was cystic fibrosis, right? And something with the machines that they need. Do you remember? I can't remember what it was, but it was some disease that needed this special equipment, and there were shortages and just issues with getting this equipment. And people on Capitol Hill, they did not know about it and were not aware until a bunch of advocates came to the Hill and said, we need you to help fix this. This is a major, major problem. These patients need these machines. And so there was a way that they, or I guess I should say, there was a way that they could address it on Capitol Hill, and they did, which was really awesome. So when he gave that example, I guess I was under the assumption that, well, of course they know about how awful the cancer treatment is and how little or few cancer protocols there are for all of the different ultra rare cancers, or how deadly a lot of forms of cancer are, but they really don't know. And a lot of people, I mean, if you ask your neighbor 4 houses down from you or in your apartment complex, hey, did you know about this cancer or pediatric cancer or these ultra rare adult cancers that have no treatment? A lot of times they don't know either. And so with everyone on Capitol Hill, there's just going to be a lot of issues that they just do not know about until we tell them, and we kind of raise our flag and say, this is a major issue and we need your help to fix it. And so I always encourage everybody, no matter who they are or what their job is, if you're working at Target or if you are a scientist, please, please, please write in or call your representatives and your senators so that they know about these issues. And we can help you, John and Felicia and I were all able to help you navigate the system or help you know what bills are out there and which ones need support. And there's a lot of ways that you can get plugged into. And we're doing these cancer conversations, because cancer advocacy conversations, so that we can keep this dialogue going. And we want to be able to share which pieces of legislation are out there that need support, and how we need you to share your voice and raise your voice for us and with us. Not necessarily for us, but with us. And just be able to really, I don't know what better way to say it. I just think of this like kumbaya. Like, I know this sounds so silly, but we all know kumbaya, right? It's like this, kumbaya circle where we need to band together and all go with these issues and make sure that our representatives on Capitol Hill know what we need addressed. And there are, not to get super emotional, but there are a lot of people hurting in the cancer community, whether they're bereaved parents, whether they're spouses or mothers and fathers and sisters and brothers who have lost a loved one or are in the fight, and you're watching your loved one go through, and it's just the most horrific thing. And I know that when Finn went through his, we had so many people in the community that were like, what can we do to help? Please let us help. And they want to throw money at you, and they want to throw gift cards and gas cards. And all of those are super amazing. Don't stop doing those things. But what we also really need is to get to the cures faster. And we all know that research is important. And part of the way that we can help with research is by increasing the tumor data that is available through molecular diagnostics. And like I was talking about, that bench to bedside, it all plays into that. And it is so, so, so critical. And not everyone is going to be on board with it because they know it costs money to get these tests done. But really what it comes down to is saving lives. And I think that by stressing that, by those of us sharing our stories and stressing that, we can be louder than the people saying that it's too expensive. So that's my plea. That's my rally cry to all of you. And please reach out. I love talking about this. I know John and Felicia do too. And we want to have more of these conversations. So please give us feedback on what would be helpful, because we really want it to be productive and we want it to be useful for you and all be in this together. So any other questions or comments or things that you want to have the conversations include in the future? I mean, we could all sit at our computers on a Zoom call and kind of write our letters and bounce ideas. I mean, I'm happy to host those. You can grab your favorite beverage. This is really coffee, but you could grab your favorite beverage and we can, get to work together. So yeah, please give us feedback too.
Oh, yes, I think we have a hand up.
Azalea?
Yep, I feel like I'm back in school. I'm not see me. Let me see. So there it goes. Hi. I just wanted to share. I am based in Las Vegas. My son is a 2-time survivor, and I was emailed through a local nonprofit who I had recently became a part of. So and that was Tyler Robinson Foundation. So I just wanted to share and say thank you guys for, this information. All this is really great because we are out of the thick part of it, but we are still very much involved. My son is 7, and, without this stuff, these emails, I just want to say that a lot of families, you're going through it. You don't have the surroundings to explain and, let you know what's going on in the world because you're in this bubble. So I just wanted to let you know that I'm going to share and do my part as far as this bill, whatever I can with these mothers and with my son. He is 7 now, so he was 9 months when he was diagnosed. And this year we're finally able to share. He is also ambassador for St. Baldrick's. So, if there's anything we can do to help as far as like the kids side, things that you think, anything, I'll follow along and stand by because this information was very helpful and great. So I just wanted to say thank you guys for everything you do on behalf of, as a mother and everything. So this is really great. So I'm going to take action, do my part, and continue to follow along. So I just wanted to say thanks, and everyone have a good night.
Thank you so much.
Thank you.
Thank you for sharing your story.
Yeah, that's so awesome. And please reach out if you want to connect. And I'd love to hear what you guys are doing in your community too, and to stay up to date with that. And congratulations to your son and all of you.
Okay, well, with that, we can end a few minutes early, but I know I put Felicia put the contact information she was talking about in the chat, and I put mine as well. We will have, if you signed up and you registered, which you probably all did, we will send out a link to this so you can watch it again. You can send it around to folks that you think might be helpful. So we look forward to continuing to connect, and if there's anything we can do to be helpful on this bill or just on advocacy in general, please reach out to any of us. We're happy to help any way we can. Okay, good night, everyone. Thank you.
Thank you. Good night.
Hey, thanks, everyone.